We were newly designated as a level 4 trauma center, and so the intent is to bring trauma patients here to exercise that ability. We wanted to have 6 patients that specifically would task the emergency department as a mass casualty that would be serious enough for them to act and make decisions on where the patient would be routed to within the hospital.
When you have a mannequin that doesn't speak back to you, it's kind of just more role playing. But when you actually have somebody who is lifelike, that is able to moan and tell you where the pain hurts, it gives them a better comfort with dealing with critical patients and knowing what to do in these situations and who's the team roles, who is doing what, so the patient gets all of that care at the same time.
Emergency medicine is all about making decisions on your feet. You never know what you're going to get when you have a patient arriving, and sometimes we have days where there is a whole lot of low acuity, and sometimes we have some very, very sick patients in our apartment. So we constantly have to readjust the way that we're thinking and apply our medical knowledge to the patients.
As a triage officer for the Ascal, what I would do is I would prepare the team as far as what's happening, what patients to be expecting. As the ambulance would arrive, they would offload the patients one at a time. We'd make an immediate triage. I think it's important to have exercise like this because it is a critical thinking type of event. If we don't think about it routinely, then we're going to struggle with the thought processes as it develops. There's a lot of stress, a lot of tension. Trying to make it as real as possible becomes muscle memory. First and foremost, I think the thing that's going to let us know is, one, give us a base understanding of how well we flow, but more importantly, it gives us some things to focus on to make improvements. The fact that we've come out of this thing knowing some good things, but then being able to make some changes and improvements, that's actually where the real asset and benefit of this training is.